Dr. Lal, can I ask you, your quick thoughts on all these will require tremendous focus on improving operational excellence. And I think that's a question for all of you, whether home care or medtech, health tech, medical insurance, definitely hospitals. So, Dr. Lal, from your vantage point in the industry, not only as the diagnostics leader in this country, any quick thought on how to get back the ship on shape by improving operational excellence? I mean, one quick way is to reduce cost, but we cannot compromise on quality of patient care. So, any quick thoughts, sir, Dr. Lal?
I think the first thing which must be, changed is the perception of the private health players in the eyes and the minds of the, our people, the population, including the judiciary, including the, legislature, the lawmakers, whatever. So this has to be done in a very calibrated kind of a view. And I've always maintained, and Ashutosh is actually facing the brunt of it these days, in the government's eyes, the private players, they are not actually looking at what your difficulties are. They are saying that, well, this is the price which is acceptable to us, and you have to do it. And they don't say take it or leave it, you have to take it. So this, unnecessarily the atmosphere gets vitiated. So my first wish would be that there should be kind of a meeting ground where at least it may not happen, the operation, they may not be able to solve anything, but at least with a full kind of a mind, they are able to listen to you. With an open, as they say, you can't shake hands with a closed fist. So that I find is still missing right now. Sure. And this is not the forum to discuss those kind of
of course
which are happening around the country. The second thing which I would like to emphasize is that this is a pandemic where India has been caught napping as far as the infrastructure was concerned. And initially, if you remember, there were no N95 masks, there were no PPEs, and many medical personnel got infected because of the lack of these minor things, and everything was made in China. So I look at it in a very positive kind of a way, that this is the time when we can actually do something on the ground here and move away from China. And as I told you that that there are people like Agwa and BL and Maruti and Mahindra and Mahindra who have stepped into making ventilators. And that too, 40,000 ventilators is not a joke when there were just a few thousand, present in India.
Sure.
So India is capable of changing, but who will bring that change? Point number one.
Good. Yes. Thank you. And
the second thing is in testing, of course. The testing, according to government figures, should touch about 2 lakh patients per day, and it has already crossed 1 lakh patients per day. But the attitude towards testing of various agencies is not what it should be. It's a very open and shut case. I mean, all of us are coming from a very heavy background of healthcare. And such thing, we used to talk about tuberculosis, that is he an open case or is he a closed case? Would you stay in the same room with an open case? The answer is no. Right now, these open cases are, the policy, what Ashutosh was saying, that the policy is flip-flop. Today, yes, tomorrow, no, and day after tomorrow, maybe. So all these kind of things, we must get our act together and move, forward in a calibrated manner.